Kayelitsha in Cape Town now has nearly 6,000 coronavirus cases. The township recorded its first infection at the end of March. The area has been the second highest number of COVID-19 cases after the Tygerberg district. Samuel Flans is a resident of Kayelitsha. He's been working on documenting the experience of residents there with It's a partnership with the Bhekisisa Center for Health Journalism. He joins me now for more on this. Samuel, it's a pleasure to have you with us on The Pulse today. I think maybe just a bit of background in terms of you being a resident of Khayelitsha and also being a videographer and having aspirations of this career, and how you came about documenting all of this footage on what you're seeing in your community.
Yeah, thanks for having me, and also thanks to Bhekisisa for the slot. You know, when the pandemic first hit South Africa, people didn't believe if it was real. You know, so now that the lockdown has been implemented, and then people couldn't travel or go to work, and some people were getting the virus, and it's people who are close to us. So people started to take it serious. They saw it was real, and people are now scared, and they're also scared to test because apparently it hurts. You know, and the lockdown itself, people thought that it was a system for them, to lose their jobs and keep them in poverty. So, but as the time went by, they saw that it was real, even though they didn't take it serious at first, because other people, they took it as a holiday. You know?
It does take things to another level when your neighbor or even your family member who lives with you in the same house is contracting COVID-19. Speak to us about what people have been saying to you in the interviews that you've been conducting with them. What are their biggest fears? What is their thinking around COVID-19?
Yeah, they are scared because they don't know who is infected. They also don't know where are the places that they are more risky to get the virus. You know, so they are scared of death. They're saying that at least if you live with other diseases like TB or HIV, at least it's better that you know that you have it, like the symptoms are quicker. And then, the treatment, you're gonna take the treatment for how long? So with the COVID-19, it's a bit difficult for them, and it just changed everything in their lives as well.
Sure. I'm interested to hear exactly how attitudes in Kayelitsha changed as more and more people tested positive, because you'd remember the reports from our reporters out in the Western Cape who consistently were telling us about how there was no social distancing. You'd remember Nasi Pisame with those crowds in Kayelitsha, and people simply didn't think that this was something that was real. Let's take a look at Samuel's video. This is part of the content that he's put together.
All of us is traumatized, Central, the whole world is traumatized because this thing is not cure, and it's going out of hand now because there are more numbers, you see. So ungayazi bayephi yona nto ofuneke uyenzile yona iyoyikisa ngakumbi ke ngoku lenginqe yami khona lesopa apha emoli ibivalile kuthiwa umuntu ebenayo to think into yoba ubukhe waya phaya uyazi noba lo muntu kuthiwa benayo mhlawumbi ngulo bekuthengisele. So iyakothusa xa usiva into ezinjalo ngoba siyayazi uba ikhona yona qha ke kuba singaba bantu sicinga into yoba ayinandifumana.
Sure, and many of those residents in Khayelitsha are reflecting on their own experience. Samuel, I want you to tell me, how different were people's behaviors once they started seeing the virus in their community and seeing those local transmissions versus when it was still something that they heard about on the news?
Now that it was so close to them, they started to take it seriously. They started to even follow like the rules and regulations we were getting from the government and our healthcare organizations. So they are so scared. They are so scared, but it's one. It's few individuals that they are ignorant. But now people, they do know that the COVID-19 is real and it's here. It's for everyone, because at first they believed that it's for people who. It's for rich people who travel the world,
Yeah.
But now that even the lockdown was implemented, they knew that this is for everyone, and it's so serious because other workplaces were closed and people were retrenched, So yeah, they are so scared mostly.
All right. Well, it's interesting to hear just how that sentiment is changing. And I wonder how much more information and communication needs to be done with different communities so that the fear and the anxiety that is gripping them can be somewhat eased.